All right, guys, I am waiting to pick my daughter up from practice, so I figured that we could talk about topic number 2, which is hypertension. A couple of things that we can naturally do to lower our blood pressure or to stave off hypertension altogether are, first and foremost, you want to maintain a healthy weight. So if I see someone come into the office, especially after the holidays, and they come in and they've gained, anywhere from 5 to 15 pounds. I do see it in their blood pressure. You want to keep a healthy weight. You don't want to be gaining a significant amount of weight over a short period of time. That puts excess stress on the heart, and often raises one's blood pressure. The weight that we worry about the most is abdominal weight. If you're a person that carries your weight in your belly area, those are the people that are higher at risk for a cardiac event. So you really want to watch. One of my friends is a nutritionist, and she always tells me that if the weight is carried all over the body, it's usually not just nutrition, but if you're really holding it right in the belly area, it's from mainly diet. So you want to be eating, in my opinion, a Mediterranean-like diet. Those are the healthiest diets, according to most of the literature that I read. Unless you're diabetic or whatever, then you're going to alter things. But the Mediterranean diet is high in fish, your healthy grains, and tons of vegetables, all your good fats in that diet. Let me preface all of the videos that I am putting on here by saying what I am telling you is tricks and tips that I have learned over the years from various specialists, other providers. In no way should what I am telling you take away from the fact that you should always go and see your physician or provider, nurse practitioner, PA, whoever you see, and always get a checkup or get their advice if you are concerned about something. Do not use these videos as, your words in stone. You always want to get a checkup if you think something is going on. Okay. So secondly is you want to watch your salt intake. So a high salt diet will also raise one's blood pressure. So if you are a person who is taking the salt, putting it on your food before you even taste your food, that is a practice that is not healthy. I'm not against adding salt to foods, but you shouldn't be sprinkling it in your hand and sprinkling it all over your plate before you've even tested the waters. Another thing is exercise. So 30 minutes of exercise clearly does a body good. Daily, at least 5 days a week. If you have any type of heart condition or other chronic illness, you want to always speak with your physician or practitioner before adopting any kind of diet or exercise. But the more sedentary one becomes, the more unhealthy your heart becomes. It is a muscle. It needs worked out just like your leg muscles do. And you see how weak our leg muscles get. We get lazy. We miss the gym for 3 months in a row, and our leg muscles disappear just like the sun in Pennsylvania. Anyway, so you want to be working out. A couple other things that you can do are watch your stress. I understand that we all have stress, but stress will kill you. You want to take time for yourself, and I do tell this to my patients. If you are having an exceedingly stressful time in your life, it is very helpful to meditate, do yoga, wake up 30 minutes early just to have 30 minutes alone before the rest of your house wakes up, and you can read your Bible or write in a journal or take a morning walk. I mean, whatever you want to do, just take at least 30 minutes a day to kind of de-stress, recenter, and get back on track. Heart health. Another thing is, we always have to watch our fat intake. Back to that healthy diet. Some of the easy things you can do are, we don't want to be eating fried foods. I like a chicken tender just as much as you do. but I'm not eating them 4 times a week. You know, if I eat something fried, I'm definitely kind of eating better the next day, or I'm going for a run or going for a walk, doing something of that nature. So you kind of want to watch what you're putting in your mouth. If by chance you work swing shift, then this part doesn't pertain to you. But for most individuals, a healthy sleep schedule is really important to not only heart health, but entire body health. It's how our body kind of resets for the next day, regroups, kind of, relaxes and gets everything back in check to start the next day. If you're a person who is not really sleeping at night, napping throughout the day, your body's not getting the rest it needs. So adequate sleep schedule is really important as well. Now, say out of nowhere, you usually have a really good blood pressure, or at least a decent blood pressure, and you notice that when you go to the dentist or you go, to physical therapy, and every time you're getting your blood pressure checked, it's all of a sudden through the roof, or not even through the roof, but elevated. And you don't feel like you're having excess stress. Nothing has really changed. So you come in to the doctors. These are just a couple things that you want to be checked for. So if you haven't had a stress test or an echo in a while, that might not be a bad idea if you're over the age of 60, just to make sure that when your heart is under stress, it is reacting appropriately. And an echo will take a picture of your heart, and it'll tell us that your chambers are filling the way they should and emptying the way they should, and that your valves are not leaking. So you want to get those two things done. You also, you can get just a basic EKG in the office just to make sure that, your heart rhythm is normal and everything's kind of plotting out the way it should. But you can also get a sleep study. A lot of people don't know that untreated sleep apnea leads to hypertension, kind of out of nowhere usually. So most people, when I bring that up, will say, I don't have apnea. I don't wake up gasping for air. Well, the crazy thing is most people that have sleep apnea don't know that they have it. You might think that you're just waking up in the middle of the night and turning over because you're uncomfortable or you feel like you toss and turn. But sometimes it's your body naturally waking you up because you're lacking oxygen. And so it will adjust you. It will make you turn over or reposition yourself or wake yourself up enough so that you take a breath and kind of reoxygenate your body. So it doesn't help to get an overnight sleep study. Other than that, your practitioner can also do an ultrasound of your kidneys to check your renal artery status. So sometimes you could have a little bit of a stenosis in there that's causing pressure in your vascular system and making your blood pressure rise as well. Clearly, you want to get some basic lab work just to make sure everything else is okay. But those are some of the easy tests that we can do just to make sure that there's nothing behind the scenes going on that is causing this hypertension. All in all, it's basically diet and exercise, proper sleep, and giving yourself, a little time to unwind each day. The worst thing we can do also is to eat late at night. Like I said, when we're sleeping, our body needs to rest to regroup. A lot of people will eat a midnight snack or just something late at night. They'll eat dinner and then, at 9 o'clock or 10 o'clock, they feel like they want to eat a little bowl of ice cream, just a little bowl, or one cupcake or whatever it might be. Well, the terrible thing is, if you go to bed within the hour after that, your body is not resting. It is digesting food. So for anybody that wears a Fitbit, I would like you to, if this is a habit of yours, I would like you to see what your nighttime heart rate is and then go a week without eating a snack before bed. Stop eating between 6 and 7 o'clock at night and then see how much your heart rate goes down over that week, because your heart can rest because it's not helping to digest food while it's trying to sleep. So stopping eating late at night, that's also a helpful tip. All right, so I see my child coming out of practice, so I'm going to wrap this up here. Subscribe to my new channel as I am out of YouTube jail. Oh, God. And we'll see where tape 3 leads us. All right. See you guys.